Hi, everybody. Marina is here, your growth to scale strategist. Today, I have the pleasure of interviewing Tammy Reether. She's a business growth specialist and she specializes in transforming and restructuring medical clinics, growing them from negative bottom line into a positive bottom line. So I'm sure we all can learn something from her experience. Thank you for joining us, Tammy, and I'm so excited to have you here.
Thanks, Marina, for having me.
Tell us, Tammy, you have so many years of experience in the medical industry. What have you been doing and what are you doing today?
What I have been doing, or what I have done in the past, is helping businesses that have lower RVUs in the red, so to speak, not really bringing in the income or the reimbursements that they've had the potential to have, up to bringing those to businesses in the in the black, where they're making a profit. What I'm doing now is basically the same thing, just working with clients to bring those businesses up to a standard where they're not in debt, where they are more cash flow and profitable.
How did you start doing that?
Actually, it was really not in the medical field where I started doing that. I actually did that in real estate and mortgages. And so I became a loan officer in my late 20s, and kind of a side thing from nursing. I love business, so trying to get out of the nursing side of it a long time ago. And I grew from there, became a personal assistant for a broker, and then became a broker myself, helped open 3 offices or 3 mortgage companies for different individuals. And I'm like, well, why am I doing this for everybody else? I can do this for me. So was in my early mid 30s, and my husband's very supportive and was like, go for it, do it. So opened our mortgage company then. That was a long time ago. And we decided that, okay, well, with all of that, that's well and good, all that experience. And fast forward a handful of years later, and I'm working as a nurse. The CEO was like, hey, do you want to come and do this? And I'm like, yes, let's do it. So that's how I got started.
So the CEO came to you and asked you to help him restructure his clinic?
Well, it was, I was asked to come to be a supervisor for a clinic that had a lot of providers and stuff in it. And then I'm a few days into this, and I get a phone call that says, come talk to me. And he had been doing some research. Of course, in the medical field, when you hire someone, or any field, you're going to look at their past. You're going to look at what they've done. And his thing was, I don't want you doing this job. I want you to do this. And so that was where I was just initially over just running the urgent cares, a few locations, to nope, this facility is having a problem. I want you to focus on just this facility, all of it. I want to give you the ability to, see what you can do. I want you to turn this around. And in a year and a half, it went from in the red to in the black, to increasing providers' RVUs, to having happy people that made money.
So what were the challenges that you identified and helped turn it around?
Challenges, documentation was one of them, because whenever you're working with insurance, you have to document with what, and to support what you're charging, or what you're billing for. And an ICD-10, ICD-9 at the time, requires specific documentation for specific things. And it was educating the staff on how to document, educating them on importance of documenting, because there were times where you go in and they don't feel like documenting something because they're just tired, or it's been a long day, or they forgot. It's really starting with the staff and getting the staff on board and having them understand the importance of their role and the positive effect they can have on not only the finances coming in, but the morality of, providers make money. When they're making money, they're in a good mood, and that's going to be a better working environment. Not only that is just the facility can actually purchase more and do more if they have things coming in, and which makes happier environment. So it's kind of like an all-encompassing thing of getting everybody on board and a lot of training.
So you've been doing recruiting as well, team management, because when we were talking about the fact that you were doing a lot of our side as well, not only the training portion. So I'm curious what has been done in those clinics in order to switch them from not functioning to very efficient, very highly producing environments, clinics. And what is that switch in the mind of the employee that you had to do, other than understanding the importance of, if you don't do this, then we're not getting paid? Because it's a mindset, right?
It's a mindset, and sometimes it means getting rid of employees, because if you have someone who is not willing to grow and not willing to learn and do their part, if they're more in that toxic environment and they're not basically pulling their weight, it becomes an issue with everybody involved. So it comes down to hiring correctly. So whenever you interview, I like to make sure that when I'm putting somebody in a position, let's say that they're answering the phone in the front. That's an easy one, right? A lot of people are, hey, you just need to answer the phone. Be nice, smile when you answer the phone. That smile comes through, right? It goes beyond that. It goes to, is this person, am I able to cross-train them to do another job? So if somebody doesn't show up, where in that facility can I plug them in to be able to utilize them if the flow is off? So recognizing the flow, getting the flow pattern down as well is very important. But having somebody who is knowledgeable, pleasant, and trainable to be able to, no, we can't have in a medical facility, we can't have someone answering the phone, going back and starting an IV or giving shots or something, but I can train them to take a blood pressure. I can train them to weigh somebody. I can train them to do something a little different, restocking or something where it kind of takes the pressure off of the people in the back that are short. What can this person do? And vice versa. What can my paramedic or my nurse in the back, can they come and help out at the front if they need to? Can they take a payment? Can they answer the phones? Can they schedule appointments? What can we do to make sure that everybody can be, yes, they have their specialized thing, but can I use them for other things in case we get a little behind or we're in a pinch? So that's kind of a few of the things without getting more specific.
Yeah, that's a very good point. In many cases, people that are hired are feeling stagnant. I'm doing the same thing over and over and over. And at some point, maybe 6 months down the road or 12 months down the road, they're just looking for either a new opportunity in the business they're at, whether it's a medical clinic or any other business, or they're starting to look outside because they get bored and they're losing focus, losing interest. And it's very important to identify those signs and challenge them by training them to do something else, in addition to not only for the clinic benefit of having somebody to be able to plug into that position, but also for the benefit of that person that is working for you. Because when if you're losing somebody and they're leaving on their own on their own decision, or they're leaving because you fired them, the price of hiring somebody and training somebody new is so much higher than investing a little bit of time in them and giving them the opportunity to grow and scale their abilities inside that organization. That sometimes it's just not worth the price to pay for losing them and bringing in, hiring somebody new and training them from scratch. So, have you found
Retention
that?
is important.
Sorry?
I said, yes, retention is important.
Yeah. Did you find that money is a higher motivator than the actual challenge in the business for those employees, or would they prefer more challenge, more interest versus the money?
No, I have found if you're going to challenge them and give them more, they want more money because they can go down the street and be doing what they were doing only and, answering the phone per se, making appointments, and that's it. Let's say that they go down the street and make the same amount than what you're asking them to do. So you want to make sure that you've compensated them appropriately, whether it's bonuses. One of the things that I hate is giving them food. I don't like to just be like, oh, here's you a free lunch because, that's kind of, I don't know. I don't like that. But being able to give them, gas cards to be able to, additional thank yous. If you can't increase their pay, give them something, make it worth a while. So I've given them, given gas cards where, they come in on a Saturday for covering something. Hey, here's a gas card, here's a Sonic card, drive through, go get something to, whatever, just something to make them feel appreciative and valuable. So you want to make sure you compensate them for sure.
That's a very good point. If people feel special, they will make or give more effort to the task versus if you don't do anything for them and you just demand, but give nothing in return, even though the mindset of employers, the mindset of business owners is, well, that's their job. I'm paying them to do whatever I'm asking them to do. However, sometimes those employees give a little bit more, or you don't know what they missed out at home by doing their job or coming to work. Maybe somebody's sick at home and they still made it. They don't talk about it, but it's registers somewhere in the back of their in the back of their mind. And then when something goes wrong in the workplace, everything floats up. I did this and this and this for you. I missed out on so many experiences and I get no gratitude for you other than, and that's how they think, right? Especially today, when after COVID, so many things change in the mindset of the employees where you're finding it difficult to fill positions because they see that they can make the money out from home. So why do I need to come into the office? Or why do I need to do X, Y, Z? So the way you compensate or appreciate the employees also needs to shift. And we're actually going to have a mastermind in January, and the end of January, that is going to touch on those points. And I would like to invite, there's limited number of spots. We can personally, it's by invitation, and we can invite only 3 people per person. So if you're interested, reach out to me and I'll be happy to interview you to see if you're a good fit, because not everybody is a good fit for this event. And you will be able to learn a lot about not only human resources and about how to manage employees, but many other topics that we're working on. And it's going to transform your business for sure. So, Tammy, one of the things we're going to talk about in that mastermind is about integrative medicine and how we're going to, how important it is to offer or change the way the medicine is practiced today, because the mindset and the demand of the customer, who is the patient, changes. The patients are more educated, the patients have more knowledge about what is good for them. The internet is a good educator, and they, in many cases, come to the doctors and say, I want 1, 2, 3, 4. And in many cases, the doctors don't know what they're talking about. So,
So true.
which is true. You know what I'm talking about.
Yes.
So, how do you define integrative medicine, and how did you see it implemented in the clinics you worked with? And let's open this topic, and I'll have a few more questions later.
Oh, absolutely. Those are really great questions. Integrative medicine to me is, first of all, you have to understand as a nurse, and I was raised a little different, where the providers, whether it be holistic or allopathic medicines, they are there to help you stay healthy. You, as a patient, are in charge of your own health care, period. And educating patients as a nurse, that's kind of one of the big jobs you have as a nurse, is helping them understand it's not the provider that is in charge of your health care. It is you that is in charge of your health care. You have to take control. So how integrative medicine for me is being able to integrate the allopathic physician, the MD or DO, with the acupuncturist, with the chiropractor, with the naturopathy, some other form that's going to be there to help them stay healthy or get healthy. So that's what I think on that. How that has played out is a lot of providers that are in big healthcare settings, they're not allowed to refer out to a chiropractor or wherever, for the most part. Now, sometimes a few will do it quietly, be like, I can adjust you in the office, but let's send you out somewhere. Or have you thought about maybe an acupuncturist for, your sinuses, or maybe this, that, and the other, whatever. We can get into a lot of specifics on that, but it's giving them the ability and the voice to say, okay, I'm going to partner with you as a patient, as a provider. I'm going to partner with you, the patient, and let's get you treated healthy, not just throw medicine at you because the drug company says this is good for you. And the drug, rep comes to the office and says this is good for the patient, but I want you to be healthy. So we're going to, and I see that more with DOs than I do with MDs, but a few MDs where they're more open to, let's get you treated more holistically than just throwing some pills at you. So it's being able to give them the voice and the freedom to be able to do that. So
it's a very good point.
Question.
It's such a good point that you're mentioning it, because you are talking. So there are two types of family doctors that I identified by working with different clinics. There's one type of medical doctor, especially in the family practice, that would say, somebody comes to me with Google, like, I worked 10 years to study my medical, get my license. How dare you to come to my office and tell me what you need to be done? It's my job to tell you. That's one type of a doctor. And when I was asking about the top frustrations in like one Facebook group, I asked them, tell me, what are your top 3 frustrations from patients? And one of them started ranting about that part, like, stop coming to me with solutions, let me check and I will do what needs to be done, which is one side. What you are talking about is the other type of doctor, which is open-minded to the possibilities out there. And many medical doctors that I work with actually know, and they tell me, I know that the patient knows their body better than I can analyze them in 8 minutes or 10 minutes that I see them during their visit, right?
Mm-hmm.
So if they can tell me what they think the issue is. It doesn't have to be the right diagnosis, but if they tell me more or less what they think it is, we can start exploring in the right direction. But I'm not going to dismiss them just because they don't have a medical license, because they have the medical license to their own body. They are the experts.
Absolutely. Well, I have actually, and you're right, you do have doctors that are just absolutely, what is it? They're very open to those patients, open to what the patients need and what they think. And those are great. The closed-minded physicians who are, like you mentioned, first, where I've worked with those doctors as were providers as well, not just
I
a
saw you
doctor, but
giggling when I started talking about them.
it is. I remember one where a patient came in and they had they were like, and the doctor is upset because the patient Googled, and then the doctor is out there at their station Googling the symptoms of the patient, doing the same thing that they got mad at the patient doing. And I'm standing there, I'm like, I don't know if that's hypocrisy or not. Is that, I was just like, wow, if you don't know, why aren't you just sending them to a specialist? And they're like, well, they have to have an answer. Well, they were giving you the same answer you're coming up with. I did the same thing. What's the problem? It's just, it's the, I'm the doctor. I went to school. I studied. Listen to me. I'm it. I'm the end all of everything versus, this patient's very concerned about their body. They're concerned about their health. They've done a lot of research, and and it's very true. The person that does the most investigation is a parent with a sick child, or they're going to have a lot more information than a doctor does. So sometimes they just need to listen. Sometimes it's hard to get them to do.
It's funny because our job as a growth specialist, a scaling specialist for clinics, it's not only to help you do, like, increase your bottom line, and not only to help you get the right people in the right spots in the clinic, but also help you introduce new services to the clinic and integrate new services and new approaches that will make you unique, that will give you unique selling proposition versus all the other competitors in your neighborhood, or even your state, your province. So if you're the first doctor where I know best and nobody else can tell me what to do, you will always stay at the same level as you've always been, because you're not open to learning anything new. But if you're taking the other type of doctor, where he's coming to those masterminds, that's learning those new skills, that is implementing the things that consultants and specialists and strategists like Tammy and myself are offering from experience, they are the ones that will grow and scale and be able to get a better outcomes for their patients, long-lasting outcomes. Will be able to bring more patients, because a happy patient is a referring patient. So if you solve one patient's problem, he will tell 100 people that his problem was solved and you should really go and see that specific doctor. And I've got to tell you that when I had my back hurt and I saw videos on Facebook of chiropractors in US, I'm from Canada, I saw them in US cracking people's bones and fixing them, and suddenly somebody who's sitting like this suddenly can straighten them back. That I can promise you, I was Googling them. I was Googling that doctor that I would travel from Canada to US to get fixed, because I was in pain. And I promise you that if you do a good job in differentiating yourself from everybody else, people will travel for you from all over the country and from abroad as well. There is recreational medicine. People are traveling. So that's point number one. And point number two, I don't remember what it was, so we'll stick to point number one. When in doubt, see clause number one.
I love it. Love it. Yeah.
Yeah.
And one thing that I do want to reiterate, and I know Marina, you and I've talked about this in the meetings and stuff, but having the great outcome is amazing. Having the ability for the patient with that great outcome have the voice where they can put that out online, where they can show, okay, that this provider's done really well. And having the ability for the provider, a voice and a platform for the provider to feel safe enough to come out and not feel ridiculed or something for their stance of having a patient-led practice, basically, is kind of what I think of it as. I don't know if that's such a thing, but that's just, to me, in my mind, having a provider there to be the sounding voice and a guide of where I need to go versus the be all end all is to me more along the lines of where I see our healthcare industry going. And I think that's a great thing. I think COVID really put a lot of people in the driver's seat of their own healthcare, and had a lot of people that never thought about healthcare before, or their health in general, start doing a lot of research on how is this going to make me healthy? How am I going to get healthy? How am I going to stay that way? And yeah, I think that was a big blessing out of the curse of COVID, that we've got that little shift within the healthcare industry. At least I hope it's a shift.
It's interesting that you mentioned COVID, because when COVID hit and the government said there is no solution for it, there is no vaccine back then, there is no pill that you can take to fix your problem, people started researching about natural solutions for it. So you would see a lot of, and some of it was misinformation, but you would see people talking about taking zinc and if you take zinc, you need to take C vitamin in order to increase the potency of that zinc, and that it triggers the immune system and helps it. So, and there were other pills from other plants that were recommended in order to boost your immune system. So my point is that during COVID, because people were stuck at home and because they were told there is no medical pharmaceutical solution for the problem, which is a pandemic, they started looking for more natural ways to do it, to help their immune system to deal with the problem. And I'm not saying that the pharmaceutical is not a good solution and is not the way to go when you're sick and you're under the weather. I'm just saying that it's an integrative medicine where you take the natural solutions, you're taking the natural remedies, whether it's and it's not only natural, by the way, it can be stem cells injections, it can be some electrodes when you have muscle tightness. You can, instead of taking a pill to relax your muscles, you can use some electrical stimulation on your muscles that will do the same thing, but will have better result, on a long-lasting result, versus taking a pill every 8 hours, because that result will be temporary and the pain will come back until you fix the problem. In many cases, the pharmaceutical solution is just a patch on a bigger problem, and that patch is temporary. So, oh my God, I didn't think we'll go in this direction. It was not planned. We had a completely different agenda. So I'm not going to cut it out. I said I'm cutting out all the things that I'm rambling about in many cases, but this is not going to be cut out because it's good stuff.
It's relevant.
It's very relevant, especially in the COVID time. The last 2 years were very difficult, and people became more aware of the options out there.
And you know what is really interesting is because you have providers. I've been seeing providers during COVID and after where they, are high doses of vitamin C, zinc, magnesium. They're giving, just a lot of these different, vitamins and minerals or mineral salts and stuff together. But what's really interesting is whenever you have those same providers, saying, okay, well, take this vitamin regimen for prevention of COVID. That's the vitamin regimen that I was taking to prevent myself from getting the flu on the floor or in the emergency room or wherever as a nurse. And that's something that that exact vitamin regimen for prevention of COVID, to potentially make your immune system as healthy as it can, to doesn't stop you from getting them, but it helps decrease your chances of getting a virus.
Or
That's something that my absolutely, and recovering faster. That is stuff that I've been taking and my family's been taking for decades to help with managing and preventing flus
and suddenly
and
it's
just the
news.
hundreds of viruses out there. Absolutely. And all of a sudden, oh no, it's not good because it's not recommended because it's COVID. And then all of a sudden after COVID is the pandemic is over and everything. Now it's like back to the norm. So it's very interesting.
It's definitely interesting mind shift in the, well, we didn't have a pharmaceutical solution for you, so here's the patch. Well, they called it a patch, but here's a natural solution. And now that we're back to normal and COVID is decreasing, oh, don't use it anymore because it's not good. So it's very strange. I was we have mega success in a couple of weeks, and I took some of the things that I bought to wear to be fabulous. So I took some of these things to a seamstress to patch it up and like shorten it and do some things that will fit me better. And she had a cold. I saw her nose; she was reddish. The moment I got home, the first thing I did, I popped zinc and vitamin C, because she wasn't wearing a mask. I wasn't wearing a mask. It wasn't COVID. She just had a cold, but I don't want to get sick in the 2 weeks that are upcoming that I need to travel. So what I did exactly what I did when COVID started, which is boost my immune system. So yeah, it's, again, you're the patient, if you're the patient, and even as a doctor, you're still the patient. You're just very bad patient. Yeah, just treat yourself, and not everything requires pharmaceutical solution. It's not a popular opinion, but there are other ways to do it, and we're going to touch them in January. Thank you very much.
Thank you for having me.